Hello friends, let us now learn some important points here. So the first question from Robbins. This question has been taken from flashcards of Robbins. So that states that. So here question is 70-year-old woman has a history of blood pressure of 160 by 105 millimeters of Hg for many years. Abdominal ultrasound showed decrease in size of one kidney. What is the gross morphological description applies to abnormal kidney? See, this is the kidney which is present, and this is the one more kidney. This kidney has become smaller when compared to this is the bigger kidney, right? No, so this smaller kidney has undergone atrophy. Then second question, what is the likely cause of this finding? It can be due to the renal artery stenosis, which occurs due to atherosclerosis. Due to atherosclerosis, there can be renal artery stenosis resulting in decreased blood supply to this kidney, thus causing atrophy of this kidney. How could this affect the patient's renal function? Okay, if you see the patient's renal function, first and foremost there is in first and foremost there is decrease in blood supply to the kidney. So because of decrease in blood supply to the kidney, there will be less blood flowing through the kidney. So as a result, the JG cells get activated and they will release renin. This renin will cause hypertension. So this is one thing that happens. What cellular organelle plays an important role in this process? In the process of atrophy, mainly the lysosomes are involved in the process of atrophy. In the process of atrophy, mainly if you see, the lysosomes are involved in the process of atrophy. Then what cellular processing pathway is involved? Here cellular atrophy is done by the process of ubiquitin proteasome pathway. This is important. So this is the answer for this question. Thank you for watching my lecture. Thank you.